Implantable Cardioverter Defibrillator. Introduction. The lower left chamber of the heart is called the left atrium. Select true or false. Correct. The lower left chamber of the heart is called the left ventricle and not the left atrium. The ventricles are in the lower part of the heart. Which of the following best describes arrhythmia? Choose one of the following options. 1. A slow heartbeat. 2. A fast heartbeat. 3. A chaotic heartbeat that slows down and speeds up. 4. All of the above. Correct. Any change in the way the heart normally beats is called an arrhythmia. Some are mild and some are dangerous. Which of the following best describes the heart during ventricular fibrillation? Choose one of the following options. 1. It beats slowly. 2. It shakes very quickly. Correct. Which of the following is a function of an ICD? Choose one of the following options. 1. Monitor heart rhythms. 2. Store information about heart rhythms. 3. Deliver electrical shocks to restore normal heart rhythms. 4. All of the above. Correct. The risk of infection is common for ICD surgery. Select true or false. Correct. Infection is rare during and after ICD surgery, but infections can still happen. It is impossible for the wires of an ICD to break, become loose, and lose their connections with the heart. Select true or false. Correct. It is possible for the wire to become loose during contact sports or spontaneously. If this happens, an operation would be needed to reconnect the wires. For about a month after your surgery, try not to move your arms too much or too heavily near where the ICD was implanted because the wires could come loose. Select true or false. Correct. Power generating equipment and arc welders can affect ICDs. Select true or false. Correct. Power generating equipment and arc welders use powerful magnets and can affect ICDs. Close contact with such equipment should be avoided. Let your healthcare provider know if you work in a setting where this kind of equipment is used. Thank you for using Explain.